The road to pharmacy residency is a challenging one no matter what your circumstances are, but if you find yourself as a non-traditional residency applicant, then you understand that that comes with its own set of challenges, but also advantages. In today's video, I'll be sharing a few things that I've learned over the last few years that will hopefully help you as you navigate your process. Hi, I'm Dr. K and welcome to my channel where I help you live your best life by sharing advice and tips on how to grow personally and professionally. So for whatever reason, you found yourself as a non-traditional residency applicant, and basically that just means that you aren't a current P4 student applying to pharmacy residency programs. Whether you found yourself a non-traditional residency applicant by choice or by force, the fact that you are willing to pursue continuing education to further advance your career is something to be proud of and to celebrate. I say that because that's something I want you to keep in mind as you move forward in the process, because you are pursuing additional training to further advance your career, and that's something that should never be seen as a bad thing. Okay, so a few things to keep in mind as you go into the application and interview process. The first one, don't allow the fact that you're a non-traditional residency applicant steal your confidence. Yes, you may have to do a little extra work to prove yourself, but there's nothing wrong with that. You are qualified and able to be there just like that current P4 student is. If you encounter people who change their energy once they discover that you're not a current P4 student, don't let that discourage you. I know there may be times where you interact with RPDs or preceptors or maybe even residents at programs, and once they find out that you're not a current student, their energy may change a bit. It may be intentional, it may not be, I don't know, but regardless of the case, you don't want to let that discourage you. As I said before, don't let your confidence be stolen. Don't let those things get to you. I know for myself, I had a few experiences where it was either at mid-year or different events where I was expressing my interest in a program. And once they found out that I wasn't a current P4, I could see a shift in their energy and interest in me. And for me, that just let me know that that wasn't the place for me, because I shouldn't have to feel bad for pursuing a residency after being out working in the field for a while, whether it was by choice or by force. I shouldn't have to feel bad for that. So if you come across a program that seems to now all of a sudden not have as much excitement and pep in their voice when you interact with them, then just X them off the list and keep it moving. The next thing you want to keep in mind is that residency program directors will want to know your story. They'll want to know why you're there applying and expressing interest now, whether or not you applied in the past or if it is your first time applying. So really just be open and able to articulate and express what's been going on in your life since you graduated pharmacy school, because they will want to know. The next thing to keep in mind is to use your prior work experience as an advantage, especially if you did something unique. Even if you didn't, having that prior work experience in itself is something that sets you apart from most of the other applicants who are current students. So really make sure that you use that to your advantage and don't shy away from that. I know for myself, I actually had an experience where for a brief time, about a year, give or take, I actually worked part-time at a community college where I was teaching pharmacy technician program students. And so that's something that was different aside from the job that really actually helped pay the bills. And it gave me experience with speaking and writing test questions, creating lectures, interacting with students, all of those different things. And so that was something that I was able to also articulate and express in my process of applying to residencies that was still a bit different from your traditional community pharmacy experiences. The next thing that I want you to keep in mind is to keep the end in mind. The process to applying to residencies, getting applications ready, waiting for interviews, preparing for interviews, traveling to interviews, waiting through the match process, this whole situation, everything that comes with it is a lot. It's expensive, it's time consuming, and it's emotionally and mentally draining. But it's worth it. Keep the end in mind. Don't let everything that comes along the process deter you from reaching and accomplishing a goal that you've set for yourself. The next thing that I want to touch on is that your experience is unique and it has helped you grow in some way. So you want to make sure you highlight that. Also, it doesn't just have to be about pharmacy. You are an individual outside of your profession. And so there are things that you've experienced that have helped you grow and mature into the person you are today, whether it's professionally or personally. You want to make sure you highlight that. A few things that I tried to do during that process was to highlight that having worked for a while, I've been able to mature more and come into my own as far as who I am as an individual, but also experienced things professionally that helped me identify more of what I wanted and didn't want as far as my career goals were concerned. I think it's good also to highlight that you have already made that difficult transition from student to pharmacist. And so that's something that you won't have to do during residency. You'll be a little bit more independent and be able to kind of transition into that space better. Now, of course, you don't want to come across as the overly independent know-it-all, but programs do appreciate having someone that can work more independently, because the goal throughout residency is to continue to prepare you to get to that point where you can do so. And one of the biggest challenges initially for most residents is that transition from student to now being a pharmacist, having to make decisions. Of course, in residency, you have preceptors that you still answer to and get advice from, but they do expect for you to work independently and to continue to do so as you progress through that year. Lastly, I want to point out a few things that you want to highlight in your application and interviews as a non-traditional residency applicant. First thing being, make sure that you can clearly articulate your why. Make sure you articulate that in your letters of intent, but also in your interviews. As I said before, once people see that you are not the traditional P4 student applying for residencies, they will want to know your story. They'll want to know why you're there and what motivates you. And so please make sure that you can clearly articulate that. And I would advise that you come up with an answer that's not, oh, I just want to escape community pharmacy. Even if that's your reason, you don't want to lean too much on that, because they may question how dedicated you really are in doing this, more so for career advancement and that commitment, and not so much of just being tired of where you are right now. What have you learned during the gap between pharmacy school and now where you are professionally in your work experience? What have you learned about yourself as a pharmacist and as a professional? What have you learned about your career goals, things that may have changed since you were a student? And again, as I said before, also things that you've learned about yourself and about life that have helped you mature and become the person that you are right now sitting in front of them. Specifically, when we refer to the professional side of things, you want to make sure that you can be detailed about the things that you've done and experienced that have helped you grow. Have you been in positions where you were in a managerial or supervisor role? Have you done additional training and certificates in CE educations, or gotten a master's degree, or anything that will show that you've been intentional about growing and being better as a professional and as a pharmacist? I know for myself, one of the things that I did over the years as I was continuing to reapply was that I was, number one, very active and engaged with my pharmacy school. I continued to volunteer and serve as like a preceptor for most of their community service events. I wasn't an official preceptor for the point of like the board of pharmacy and what they were looking for, but anytime they had a community service event and I was available and able to go and assist, I did. And so that kept that communication going. I kept involvement with students. It also helped me continue to see how things were progressing on the clinical side. Another thing that I did was, it was the ASHP certificate program. So like the medication therapy management and the diabetes education. I forgot exactly what it's called, but I actually did those certificate programs on my own dime, during my personal time, not at work. And those were things that I did to pursue and further advance my knowledge as I was going through that process of reapplying each year. Not only was it helping me, of course, keep my knowledge, but also it showed programs that I was committed to the process of continuing education. Next, how do you plan to transition into being a resident? That is one of the questions that I got asked often. I swear probably every interview at some point someone asks that question, because they really are concerned about making sure that you will be in position to properly transition into being a resident. And so you really want to make sure that you're able to clearly articulate that. When it comes to that transition to being a resident, programs really want to know how well you've kept up with your clinical skills so that you'll be prepared to transition and you won't need a lot of hand holding and reteaching of things that you should know. They want to know how you will mentally make the transition to be from now going from being the pharmacist that's making the decisions to now back in a learning environment where you have preceptors that are helping to guide you and facilitate your learning experience. They'll want to know how you'll make that transition as far as time, because residency will likely require more of your time than your current job. And so they want to make sure that you will be prepared to make that transition so you can still have a fairly decent work-life balance. And then, of course, the financial aspect. Not many programs really care much about your finances, but even mentioning that will let them know that you've done your due diligence to prepare yourself for every aspect that may come with that process and that transition. Okay, to wrap things up, I want to first make sure that I drive home the point. Please do not let the fact that you're a non-traditional residency applicant steal your confidence. You are there, you are capable and qualified just like anybody else. So don't let that steal that confidence from you. Don't be intimidated or get discouraged by the process. I know it's not easy. I will be honest with you. It did get harder the longer I was out of school, but it's not impossible. Myself, I had been out of school 4 years before going into residency, and I actually was in a program where one of the PGY2 residents had been out of school 9 years before she came back to do residency. So it's not impossible, guys. Please don't get discouraged. I know it's hard, but stick with it. Keep the end goal in mind, and if it's for you, it will happen. All right, so that's all I have for you guys today. I hope that you enjoyed this video. If so, please make sure you give me a thumbs up and also share the video with someone that may find the information useful. If you like the content on the channel, please make sure you subscribe and hit the notification bell so you won't miss out when I upload new videos. Also, check out a few of my other pharmacy residency videos that I have for you guys. I share a bit of my story, but also a few other videos that give some advice and tips as far as the application process. I hope you guys have much success as you move forward in your career endeavors. And until next time, peace.